waiting long. जो questions है last में discuss करते हैं. Let's start with go corona, go corona, go. So initially general information and management of COVID-19 pregnant women. Measures for pregnant women to prevent COVID-19 infection. So obviously we know at home, stay at home as much as possible unless there is a medical need related to development of symptoms. Routine antenatal visits are to be deferred. Keep the traffic of home visitors, including home care personnel, maids, and staff members to a minimum or avoid completely if possible. Wash your hands frequently and properly with a soap and water or an alcohol-based rub for minimum 20 seconds is important. Covering their mouth and nose with bent elbow, handkerchief, or tissues while coughing or sneezing. Then the used tissue should be disposed immediately. Avoid touching face, eyes, nose, and mouth with hands. Keep a distance of at least 1 meter from the next person outside and in the house. So अभी क्या बार बार सुनने को आ रहा है कि what is quarantine and what is isolation. अभी ऐसा हुआ कि वो पॉजिटिव आ गया तो उसको आइसोलेशन में डाल दिया है और उसके घर वालों को होम क्वारंटाइन कर दिया है. So what are the two different terms actually? So I would like to tell you that the term quarantine is used to separate and restrict the movement of well persons who are known to be exposed directly or indirectly or suspected to be exposed to a communicable disease, that is COVID-19 obviously, to see if they become ill. Quarantine may be at home or in a facility designated by the state, which includes hotels, hostels, guest houses, or hospitals. On the other hand, isolation refers to the separation and restriction of movements of ill persons who have a contagious disease in order to prevent its transmission to others. At present, all symptomatic patients who have a positive test for COVID-19 are being isolated. So the criteria for quarantine are the same for pregnant women and the general population. A contact in the context of COVID-19 is a person living in same household as a COVID-19 case, a person having had direct physical contact with the COVID-19 case or his or her infectious secretions without recommended PPE or with a possible breach of PPE. A person who was in a closed environment or had face-to-face contact with a COVID-19 case at a distance of within 1 meter, including air travel. So now the instructions for contacts being home quarantined, क्योंकि जो isolate हो जाता है hospital में उसके सारे relatives को home quarantine कर दिया जाता है. The home quarantined person should stay in a well-ventilated single room, preferably with an attached or separate toilet. If another family member needs to stay in the same room, it's advisable to maintain a distance of at least 1 meter between the two. Needs to stay away from elderly people, pregnant women, children, and persons with comorbidities within the house. Restrict his or her movement within the house. Under no circumstances, attend any social or religious gatherings. General health measures, as we all know and we all are following, that is hand washing, avoiding sharing fomites, wearing a surgical mask, and changing it every 6 to 8 hours with correct disposal in 1% hypochlorite solution. If symptoms appear during quarantine, the pregnant women should contact a health facility by telephone and follow the given advice. Family members of the pregnant women quarantined at home should keep a distance from her at all the times and avoid direct contact with her and her fomites. Disposable gloves should be used in case soiled linen has to be handled. Visitors should not be allowed. Clothes should be washed separately. The duration of home quarantine is 14 days from the time of exposure to a confirmed case or earlier if a test is performed on a suspect case and it is negative. So the effects of COVID-19 on pregnancy. So it is good to hear that pregnant women do not appear to be more likely to be severely unwell than other healthy adults. More of it is only mild or moderate cold flu-like symptoms. If the pregnant woman has comorbid conditions such as diabetes, hypertension, obesity, respiratory disease, or she is of advanced age, she is more likely to have a severe form of respiratory disease. So now the clinical presentation is like the mean incubation period is 5 to 7 days. Most people who are infected will show features latest by 11 days of exposure. A history of travel abroad or contact with someone who has traveled abroad should be included in the history taking. The majority of people present with respiratory symptoms. Most of the symptoms are cough, sore throat, and fever. Difficulty in breathing or shortness of breath are in a few. Pregnant women, especially those with associated medical disease, may present with pneumonia and mild hypoxia. Immunocompromised and elderly pregnant may present with gastrointestinal symptoms like nausea, diarrhea, fatigue, malaise, and body ache. So whom to test? This is the controversy. A pregnant woman who has acute respiratory illness with one of the following criteria: a history of travel abroad in the last 14 days, In addition to testing, these individuals with or without symptoms and their household contacts should home quarantine for 14 days. Is a close contact of a laboratory proven positive patient, or she is a healthcare worker herself, or hospitalized with features of severe acute respiratory illness. A pregnant woman who is presently asymptomatic should be tested between 5 and 14 days of coming into the contact and high risk contact of an individual who has been tested positive for the infection. So test methods at presently the RT-PCR test from nasopharyngeal swab is used for the diagnosis. These are ICMR guidelines that pregnant women residing in clusters or containment area or in large migration gatherings or evacuation centers from hotspot districts presenting in labor or likely to deliver in next 5 days should be tested even if asymptomatic. So now there are zones made in every hospital, in every like infected, potentially infected, and clean. Infected means those who are positive. Potentially infected means those who have symptoms of severe acute respiratory illness or have contacted with infected individual. They have traveled abroad for the last 14 days. Healthcare worker caring for COVID-19 infected individuals, and those whose test result is awaited. So these are should be kept in separate isolation areas. Isolation area includes isolation wards and an isolation ICU. If possible, each patient should be kept in a separate room with an attached bathroom. So when a patient is coming in your OPD, you can just perform a quick SOFA score. What is this? This is usually done for sepsis, typically for bacterial infection, for triage purpose. So in this, respiratory rate is more than 22 breaths per minute. Mental status if altered, systolic blood pressure less than 100. So score is more than 2 is suggestive of sepsis and needs ICU. Now the medical management, what medicines can we give to a pregnant lady? So hydroxychloroquine 600 milligram, 200 milligram thrice a day with meals, and azithromycin 500 milligram once a day for 10 days has been used successfully and is recommended now. Antiviral therapy lopinavir plus ritonavir or oseltamivir may be used in high risk groups, immunocompromised groups. Some people have used oseltamivir 75 milligram twice daily, but it's not, and in conjunction with hydroxychloroquine also. And most important is supportive therapy, that is rest, oxygen supplementation, fluid management, and nutritional care as needed. NSAIDs you should avoid, but if required, that is for fever and myalgia, only paracetamol is the preferred drug. Ibuprofen and other should be avoided. Antenatal steroids is again needs to be individualized based on women's condition and should be discussed with her and her family. And we recommend to give it between 24 and 34 weeks of gestation as before. Now, prenatal care. So there are some questions. Is it appropriate? Sorry. Is it appropriate for spacing out appointments to modify prenatal care delivery to decrease the risk of COVID-19 spread and exposure? Yes. Spacing out in-person appointment times where appropriate to reduce the number of patients in the clinic at one time is very good recommendation. Then clinicians can consider an approach, telephone-based approach to implement routine screening of patients for potential exposure or COVID-19 symptoms. Also asking about recent travel, potential exposure, and any symptoms is important. So some people ask me that which antenatal fetal surveillance or which scan is important. So for minor problems, minor ailments, you can talk to your healthcare telephonically. Essential milestone visits are 12 weeks and 19 weeks scan that are required. And in advanced pregnancy, women are advised to note fetal movements every day. So do patients with suspected or confirmed COVID-19 need additional antenatal fetal surveillance? Like you have to visit your doctor more? During acute illness, fetal management is similar to any ill or any pregnant women. In the setting of a mild infection, the treatment for influenza is like reasonable. For those experiencing illness later in pregnancy may require additional antenatal visits, and we have to consider sonographic assessment of fetal growth in the third trimester. Are there any special considerations regarding use of low dose aspirin during pregnancy or the postpartum period? Some people are asking. So I must say the prevalence of low dose aspirin used during pregnancy is similar in preeclampsia prevention as before, and no need to give or it's not required in suspected or confirmed COVID-19 cases to start for means extra precaution. Can telehealth strategies help for obstetric care? Yes, obviously the telehealth strategies are helping a lot. We all are using now various platforms, and for minor ailments, it's good to use. So now the rumors about diet, there are no special diets for COVID-19. Rumors related to diet should be dispelled. There is also no evidence that consumption of meat, chicken, or eggs leads to a high risk of acquiring COVID-19 infection. But based on such limited evidence, dietary evidence is generic and should include a high protein diet and vitamin and micronutrient supplementation. So now intrapartum care. This is more important for healthcare workers. So social distancing and wearing N95 or medically approved mask is good. Then personal protective equipment and covering all the surfaces, especially hands and face, is vital. Proper technique to wear and remove, that is called as donning and doffing, is very important and is essential. Chemoprophylaxis is recommended with hydroxychloroquine only for healthcare workers, and complete prophylaxis should be followed in case of accidental exposure. So I'd like to tell protocols for donning PPE. First, put on special work clothes and work shoes. Then wash your hands. Put on a disposable surgical cap. Then put on a medical protective mask. Then put on inner disposable latex gloves. Then put on goggles and protective clothing. Then put on disposable latex gloves. This is donning completed. Now, what is doffing? That is removing PPE. Replace the outer gloves with new ones first. Then use hand rub. Remove protective clothing along with outer gloves. Use hand rub. Then remove goggles and again use hand rub. Remove mask. Again use hand rub. So you have to use hand rub at every step. Remove cap. Use hand rub. Remove inner disposable latex gloves. This is removal is complete. So now the management of labor and delivery in women with COVID-19 infection. Separate delivery room and operation theaters are required for management of suspected or confirmed COVID-19 mothers. As we all know that there are 2 or 3 centers in Jaipur that are dedicated for the delivery of COVID-19 positive patients. Both should have neonatal resuscitation corners located at least 2 meters away from the delivery table. This is important. Resources required include space, equipment, supplies, and trained healthcare providers for delivery, cesarean section, and neonatal resuscitation. So, timing of delivery, what can we say about COVID-19? For women with suspected or confirmed COVID-19 in the third trimester to recover, it is reasonable to attempt to postpone delivery if no other medical indications arise until a negative testing result is obtained. Like we have one patient in advanced trimester, and now we are waiting for the result to come negative so that we can further plan her delivery or something. So, in general, COVID-19 infection itself is not an indication for delivery. Now, what about cesarean section or operative vaginal delivery? Cesarean delivery should be based on obstetric indications only and not COVID-19 status alone. Operative vaginal delivery also is not indicated for suspected or confirmed COVID-19 alone. Is delayed cord clamping still appropriate in a patient who has suspected or confirmed COVID-19? Yes, there are some people are saying that we should delay cord clamping, and some people are saying we should shorten it. But the current evidence-based guidelines are saying that it should continue to be followed until emerging evidence suggests a change in practice. How should umbilical cord blood banking? Yeah, this is again a good issue, but as we know that there are no reported cases of transmission of COVID-19 blood products till now, so umbilical cord blood banking can be continued. Now, something about postpartum care. So, should we expedite the delivery process and discharge process after the delivery? Yes, to limit the risk of inadvertent exposure and infection, it may be appropriate to expedite discharge when both the mother and the infant are healthy. That is 1 day after uncomplicated vaginal birth and after 2 days for women with cesarean births. Now, the important thing is breastfeeding. The CDC states that we do not know whether mothers with COVID-19 can transmit the virus via breast milk. There was a study in China on about 6 to 7 patients some days back, and it showed that the virus was not found in breast milk. The main risk for infant of breastfeeding is the close contact with the mother, that is aerosol, who is also likely to share infective airborne droplets. So, in the light of current evidence, we advise that the benefits of breastfeeding are more, so we should recommend breastfeeding. But those patients who are breastfeeding, the following precautions should be taken to limit spread to the baby. She should wash her hands before and after touching the baby. She should practice respiratory hygiene by wearing a mask and not sneezing in front of a baby during breastfeeding. All surfaces should be kept clean and disinfect she has touched. If a mother is confirmed with COVID-19 infection or who is asymptomatic and wishes expressing breastfeeding with a manual or electric breast pump, the mother should wash her hands before touching any pump and bottle, and also should wash bottle also, and should follow recommendation for proper pump cleaning after each use. Consider asking someone who is well to feed express milk to the baby. If the woman is isolated from the neonate, she should be offered psychological assessment and support. This is very important. These interventions can be safely provided by teleconsultation. So we can offer modified postpartum counseling regarding any potential changes to the length of hospital stay and postpartum care, any special considerations for infant feeding, and obviously postpartum contraception that is necessary for every pregnant lady. Thank you very much. This was my show.
Uh, how many patients with routine cough and cold as weather change? Which ones are the suspected cases?
Yeah, actually, people in some due to this weather change, they know that it's due to weather change. The suspected ones are those with fever and dry cough, and they suspect and they are appreciating any shortness of breath is there also. Then it's important to look with your doctor, as routine cough can be expected. Like some people are asthmatic, so they know that they have to take these inhalers and puffs and all. But those with fever and dry cough and with shortness of breath and any history and their contact, they know that they were in contact with some person who came from abroad, then they should contact their doctor. As
Wonderful,
people,
sir.
you are seeing that people are using that thermal scanner in every place. And why that is good? One patient of mine asked me, okay, sir, people are using that thermal scanner, is it a good screening agent? Then I said, yes, is it a good screening agent for a large population, because the temperature rises a little with this, and it continues, persistently rises. So we can screen out those persons that have increased temperature. And in routine cough, that is allergic cough.
Wonderful, sir. Dr. VSN wants to re-explain, sir, how to put and remove the PPE again, sir. That was a very informative infographic you had shown.
Okay, so I am sharing my screen again.
Yes, sir.
That is recommended by Foxy and American Society also, that what is donning and what is doffing. These terms are very regular in our when we are using this donning and doffing. So I am showing you the most of the infections we are getting this time are because of doffing. Donning is easy, but doffing you have to remember specific sequence. Now my this is visible.
Yep, sir.
My slides are visible now.
Yep, sir. Yep. Yes, sir.
So first put on special work clothes and work shoes. Then wash your hands or use hand rub. Then put on a disposable surgical cap. Then put on a medical protective mask, that is N95. Put on inner disposable sterile gloves. Then put on goggles and protective clothing. Then put on disposable outer latex gloves. This is donning is completed. So doffing is, that is removing PPE is, replace the outer gloves with new ones. Then use hand rub. Remove protective clothing along with outer gloves. Then again use hand rub. Remove your goggles. Again use hand rub. Remove mask. You can see the picture how to remove mask. Don't use your fingers or hand above the mask. You have to put it off from behind your head, or you have to insert your fingers laterally near the ears. Then again use hand rub. Then remove cap. Again use hand rub. Remove inner disposable latex gloves. Then so this is doffing is completed. And the second thing is, donning and doffing is very important. When you remove, there are many chances that if you don't remove by this particular technique that I have shown you, that there are chances that you might get infected.
Thank you so much, sir. As a pharmaceutical organization who wants to help the fraternity, even I have certain queries regarding PPE, sir. One is, what is the, see, there are various varieties of PPE available in the market. What is the best quality of PPE that is to be utilized? And one is, sir, what is the duration of usage of one PPE? Because I've been seeing that there are doctors who are using it one PPE for 2 to 3 days. Is it advisable, or is it is supposed to be utilized for a day and to be thrown off?
No, maximum 6 to 8 hours.
That's all.
The PPE should
That's
be used maximum 6 to 8 hours, and more than 100 GSM is good enough. 100 to 150 GSM is good enough.
okay, sir. Thank you so much.
And
Uh,
one question I got privately, and this is a very good question that I want to answer. The question is, what are the practical aspects of doing a cesarean section so that we might not get infected with COVID-19? So, what are the things that we should do to reduce the exposure to minimum during a cesarean section? So, the first thing is reduce the persons who are operating to the minimum. Okay. The second thing is use shoulder screen. That is, you have to use a screen of cloth between the uh, below the neck and your operating area, between you and your anesthetist, like you can say, at the shoulder level. The third thing is some people are using fundal pressure to take the baby out. So the fundal pressure, slight pressure, that is to be given from in front of the screen. That is from the surgeon side. These are very useful points when you are doing a cesarean section on a COVID-19 positive patient or suspected patient. Okay.